I'm Karabatea and represent Gnomon Informatics in Greece. And today, through this presentation, I will walk you through the HEDIMED Project platform, one of the dissemination tools that we have developed in the context of this great project. So our main goal was actually to provide a meaningful way to share exposomic data and project insights with project audiences, especially those outside the core scientific community. So our role in this project was to design and develop the public-facing visualization platform, which is part of the broader HED toolbox. We focused actually on building a user-friendly interface, which is suitable even for non-technical users. One of the most important achievements that we managed to have was integrating this public platform with the scientific platform developed by VTT, as Juha just said with us, which is where all research data are initially uploaded. Why did we follow a very specific approach? For the implementation, we selected to use the Apache Superset, which is a powerful open source platform for data visualization. And the reason was that this enabled us to create multiple chart types and build custom dashboards, apply interactive filters, and even configure different user permissions. So the final result offers dynamic, role-based access action and a high degree of flexibility on how users can explore this data. We had also to meet very specific initial requirements. You can see them in this slide. So to build a stable and sustainable solution, we needed to address how to analyze and visualize the data, how to manage and store them effectively, and of course, how to ensure secure transfer and access throughout the process. The main reason we concluded on choosing this approach was because exposomic data is complex and not always very easy to communicate. So we needed a tool that would support dissemination and allow engagement from different types of users and be modular enough to explore over time. In short, we wanted to translate science into something accessible and meaningful. From the technical point of view, we successfully achieved the integration with the scientific platform, and we created a dedicated backend pipeline to support structure and real-time visualizations. All dashboards were built with this superset, but heavily customized in order to meet the needs of HEDIMED project, especially in terms of filters and other KPIs we considered. Now, we organized the data in the platform by disease area, exposure type, and study cohort, so that users can easily navigate through it. As you can see, filters and visual storytelling can help guide the experience, and time series charts can allow users to see some trends over time. So our goal was to provide clarity, traceability, and of course, flexibility. To demonstrate the platform's capability, we focused on some specific actual use cases based, of course, on HEDIMED publications and study and datasets. So we used additionally to these already existing statistics provided by Eurostat and one very nice cross test in order to test the interconnection between the two platforms was the Helix study, which I will also show you in more detail in the next slide. So the Helix dataset is actually a great example of how external datasets can be integrated into our public platform. The dashboard we created allows the users uh, to explore key parameters and draw some comparisons, while on the same time they stay in line with the original study structure. Here you can see the dashboard that we managed to automatically generate after loading the Helix dataset through the research platform directly to the HEDIMED public platform. An important element, however, is that this platform won't disappear now that this project is coming to its end. It will remain live and accessible for at least 5 years from now after the official end. And this, of course, supports transparency and encourages the continued engagement with HEDIMED results and creates opportunities for reuse and dissemination in the future. Another key element of our approach was a user-centered design that we followed. We identified a variety of personas who could benefit from this platform, policymakers, regulatory authorities, industry, researchers, and even peasants of the general public. So this makes this platform much more adaptable and increases its value as a future exploitation asset. We also see this work as aligned with the vision of the World European Health Data Space. Responsible data management, fair principles, and users-focused interface are, of course, essential. So in the future, similar platforms could be part of broader infrastructures that combine exposomic, clinical, and behavioral data in a safe and federated way. Technically, the platform is modular and reusable. It can be easily adapted to other datasets or new research areas, and it can also serve as a blueprint in other Horizon Europe projects, or even to be integrated with AI-powered tools. So this is not just a deliverable for us, it's a stepping stone for future innovation. We try to build a platform that truly bridges science and society. It's technologically solid, user-friendly, and a future-ready tool that can support both dissemination and strategic reuse. So I think that we can say we are proud of that we have achieved, and we hope that and truly believe it can inspire similar approaches in upcoming projects. Thank you for your time, and back to you.